Community outreach is one of our biggest and strongest priorities of street nursing because we are able to learn and figure out resources that our community has or will need to have. And it's beneficial for us that we, one, live in this community to know about these resources, to explain and discuss these with our participants in the sense that either they don't know about them or they just don't have the proper education of the resources that are offered to them.
I really looked forward to my time during street nursing, so much that I even asked to be in it my senior year, because I really learned that I do love community and community health. More than just, as nursing students, we get really excited for the pokes and the IVs and the assessments and all the procedures you can help with, but we forget a lot about the communication aspect of our job and the resources that you do have to find for people. And so being able to just get to know an individual and just talk to them and get to know more about their life, but really how they are progressing, whether that's big milestones or just baby steps. Baby steps are still progress, so it made me really happy to be able to see that for a lot of our unsheltered population.
It made me realize the impact that community health has on our entire population, and everybody is human, and meeting these people where they are is able to prevent a lot of other things like going into the hospital. If we're able to help these people where they are and meet them, it changes the aspect of healthcare. But it also gives you a different perspective on your day-to-day life and how you go about your life. Maybe seeing some different people on the street, they're just still people, and I think that's important, and it's something that I feel like sometimes you're able to lose mindset of.
So my perspective has greatly changed since on people experiencing houselessness since being on the street nursing team. Having the ability to be in different areas of my community and kind of seeing firsthand the living conditions and other factors that have contributed to being unsheltered has really shifted my mindset and has allowed me to kind of eliminate some biases that I may have had going into street nursing prior to starting the street nursing team.
Street nursing was definitely the most unique out of all the clinical experiences. I definitely couldn't have really predicted ahead of time what I was going to be doing. When you start the nursing journey, you think you're going to be in a hospital every day, hooking up IVs and giving people medicines and those kinds of things, and this is so totally out of the box, but I think it's so important and necessary. It's helped me so much in my ER rotation, not only catching symptoms of withdrawal, but also seeing people that I know, but it also really helps to understand that nursing is all about people. And people are different, and they come from all walks of life. And so you're not, if you don't want to do nursing in a hospital, you don't have to. You can do public health, you can do outreach. It really showed that there's a much greater world of healthcare that's available, and there's such a need for it. So it was really, really mind-opening. I'm really glad that I did it.